As automation rapidly changes the game for drug discovery and development, it's here in the UK that one company is making extraordinary advances.
Without automation, miniaturization, 24/7 robotics, the sheer volume of data we can generate has just exploded.
Biopharmaceuticals company Vertex is combining the latest tech with its rich history tackling diseases like cystic fibrosis to create new life-changing drugs.
Let's understand the cause of human biology. Let's go after the root cause of the condition, and then let's really pour on the chemistry and bring high-quality molecules through to the clinic.
And all of this while supporting young, up-and-coming scientists and celebrating the UK's vibrant life sciences sector.
The history in this country of impact into life sciences is extraordinary. We are good. In fact, we're better than good. We're outstanding.
Welcome to this new Scientist CoLab podcast sponsored by Vertex. I'm your host, Rowan Hooper. Now, earlier I spoke with David Price, head of Vertex's Oxford Research site. David's a chemist and he's here to offer a peek behind the scenes of the pharmaceutical industry to see what actually goes on when scientists get together to create transformative medicines. After a career split between America and the UK, working with organisations like Pfizer on HIV treatments and research, David took on the exciting opportunity of leading the drug discovery work within Vertex. And today we find out what life in the laboratory is like, the problems they're working on right now, and why he's so passionate about the company's education internships. David, tell us about your background. What led you to this career in the life sciences in the first place? And what motivates you day to day?
Thank you. So first of all, I'd just like to say it's a real pleasure to be here today. Podcasts are probably my favourite media source, so it's great to be on the inside. Love it. So I'm just the classic case history. High school or secondary school, teacher called Mr. Peck, who just made chemistry come to life for me. I absolutely loved the subject. I was lucky enough to study chemistry at Nottingham, and I met my wife there. 30 years later, I still consider myself a chemist. And still married, actually, very important too. I also continued at Nottingham to do a PhD, but somehow I didn't find it completely fulfilling as a pure academic subject. And I rapidly realised I wanted to apply chemistry as a discipline to a tangible, real problem. So during the 80s, the global HIV pandemic erupted, and I realised that maybe I could apply chemistry skills to that as a calling and something I really wanted to work on. So I started my career in the UK, and I was lucky enough to be offered a chance to continue my research on the Eastern Seaboard in the US, and I moved my family out to the USA. Now, while I was working up and down the Eastern Seaboard, and in particular in Boston, two things happened to me that really shaped the way I think about life and research, actually. First was a personal challenge. I was diagnosed with a brain tumour. I was admitted to a leading Boston hospital for brain surgery, chemotherapy, radiotherapy. That was a 3-year window in my life. But amazingly, as soon as I entered that hospital, I just felt confident. I genuinely knew it was going to be okay. My poor wife wasn't so certain, but I absolutely was. This is going to be fine. And I think I still carry that with me today as a motivation. I'd love to be in a place where the general public have the same faith in research, medicine, drug discovery as I did and still do. And that's why it's a pleasure to be here today. The second event that happened while I was in the Eastern Seaboard was a professional event. Vertex started disclosing the cystic fibrosis narrative. The drug discovery community is actually very, very small and well interconnected. And I started to hear this amazing drug discovery story from now colleagues at Vertex. So I met Sabine Hadida. She's the site head in San Diego. I'd always admired Sabine, and then there was almost a little bit of hero worship to actually meet Sabine. And she played such a key role in the cystic fibrosis story. Now, Sabine is the site head in San Diego. I view her as a colleague, mentor, friend. I work with her every day, love her dearly. And that's why I am now at Vertex.
Well, tell us a bit about how Vertex works, because I think certainly at New Scientist we tend to look at the pre-industrial development of drugs, and then when it gets passed over to the pharma companies, it becomes a bit of a black box for us, actually. So tell us about what Vertex do.
Yeah, so as I went through the interview process in 2020, I met David Altshuler for supper, who's the Chief Scientific Officer, and he laid out both our business and research strategy. And they're both intertwined and very important. There's actually a really good synergy between research and business. But if I just talk about the research strategy, so before we do any wet work, we really try to understand the patient experience and then work on understanding that patient's life. And in particular, we want to work on conditions with what we call high unmet medical need. So simply put, diseases where there are few, if any, high-quality treatments for the patient. So with that understanding of the patient and his or her experience, I do believe our strategy is unique because we work only on projects where we have an understanding of what we call the causal human biology. And what do I mean by that? Well, we want to understand the disease at a molecular level. What is the dysfunctional protein? Why is that happening? How can we correct this? And because we do work so hard to understand the biology of the condition, we're trying to treat the actual cause of the disease, not the symptoms of the conditions. Now, that's really, really important to understand the difference. Because if you're going to actually treat the cause of the disease, you'll have a far better success rate in the clinic with the patients we serve. The challenge of treating the cause of the disease is it ain't easy. It's really tough to do that. So we have to rely on science and techniques that are new, that we've used previously or that we're taking from somebody else. So we have to figure out the problems that need to be solved and then use the right technology to go after that causal human biology. Because of that, we actually have an incredibly exciting pipeline in the industry when we have over 10 diseases in clinical development. So we're modality agnostic. That's incredibly important to us. But to undertake this work, that requires a large investment. And this comes back to the synergy between research and the business strategy. Innovation, it's expensive. Thankfully, Vertex is willing to invest. And we invest at a higher rate than most other companies. That's also so important because it brings a culture of confidence to our community. We are stable. We will invest. We will stay the course. And I'll come on to some examples maybe later talking about how long we are willing to stay the course.
So give us some examples of what sorts of conditions and problems you're looking at now.
Yeah, what a great question. So at Oxford, my day-to-day work is still around the causal human biology and then investing in the chemistry and then commitment over a long period of time. One of the diseases that's in the public domain is a condition called autosomal dominant polycystic kidney disease. That's one of the largest inherited genetic kidney conditions. And so we're working very hard, again, using the same blueprint as Sabine for cystic fibrosis. Let's understand the causal human biology. Let's go after the root cause of the condition. And then let's really pour on the chemistry and bring high-quality molecules through to the clinic.
So do you have a mouse model for these diseases?
Well, that's a really good question. Often not. So across the industry, there are a lot of murine rodent models used. If I could talk about autosomal dominant polycystic kidney disease as the exemplar for us, there is no mouse model. So how are we going to understand the causal human biology? Well, that's using techniques like gene editing. We can recapitulate the disease in man and then move forward. And if I just go back to the wonderful story of cystic fibrosis and Sabine as such an inspirational leader for me, there in San Diego, when they were doing that work, they were taking primary cells from the patients, pre-clinically using these cells to recapitulate the disease condition, and then treating these cells with our molecules and potential drugs to really understand their efficacy and safety.
Okay, so day to day, take us through a typical day.
Yes, so Oxford, sticking to the Vertex research strategy, we are really pouring on the chemistry and cracking the biology and delivering quality molecules. My day-to-day work, I always try and explain, runs around what I call the 3 Cs. Our commitment to the patient, capabilities on site to execute research, and then most importantly, our culture. So if we just go back to the commitment to the patient, which is why I come to work. So I think the most important thing around commitment to the patient is asking just fundamental questions. Are we doing all we can to deliver high quality medicines to the patient? Are we using our resource appropriately? Are we just pushing as hard as we can? So that's the commitment to the patient. Capabilities, the world is moving on quickly. We are constantly assessing the technology we have in our laboratories. Is it state-of-the-art? Is it contemporary? Is it helping us to solve the next wave of problems we're faced? So capabilities, and also capabilities of our people. The skill sets we need from our colleagues is often changing. We're very well resourced in Vertex. Do we need to go higher, these new emerging skill sets, or can we upskill our colleagues? So commitment to the patients, asking the right question, capabilities within the laboratories and capabilities in the skill sets of our people. And then finally, the culture. It is not a cliche to me, but culture is truly competitive advantage. And if you ever came to Oxford, please do. I think the one word I'd love you to see in Oxford is buzz. Huge energy. That is so important because preclinical drug discovery is tough. It's just hard yards. And you need that energy. You need to be relentless.
Well, it sounds like you've brought that from Boston, because whenever I've been to our office in Boston and Cambridge there is an palpable buzz in there. With all the pharmaceutical companies going on, as well as MIT and Harvard and all that.
I love it.
It's absolutely on fire. And I've always wanted there to be that, to feel that, what I feel in Boston and Cambridge, to feel it in our Cambridge and our Oxford over here,
Well, I'd like to go one step further. Come to Oxford, the Vertex site, you'll get buzz. And I think one of the reasons we have that buzz is because we recruit pretty much globally. Right, we have a fantastic brand recognition. People want to work with us and for us. And so we have over 30 nationalities on site, right? I love it when I go to the coffee area and I hear German, Spanish, Italian. It's just brilliant. So I do think that diversity of recruitment, different ways of thinking, different ways of taking on the problems.
Okay, well, let's looking at how things have changed even in the last few years with genomics and other omics revolutions. Tell us about what Vertex is doing in that area.
Yeah, so if I could actually step back for a moment and then I'll answer the omics question. The revolution in the industry for me over the last 25, 30 years is actually automation. Automation has led to miniaturization of the experiments we can do in chemistry and biology. You can also run them overnight. So with that automation, miniaturization, 24/7 robotics, the sheer volume of data we can generate has just exploded. And of course, for genomics, proteomics, metabolomics, it's the data that matters. And now we can generate way more data than we ever could 30 years ago.
Yeah.
But that's not just the capabilities that I talked about earlier. It's also having people who can harvest that data, interrogate that data. And then that's, again, led to different skill sets over the last 30 years. Increasingly, when we're interviewing a biology colleague for a role, they're very proud now. A lot of people are very comfortable with scripts, algorithms, statistics, and that is just so important to the world we live in. So I love the fact the Ellison Institute is now opening up in Oxford at the interface of genetics, mathematics, biology. These are exactly the skill sets increasingly we recruit from. Why? Because it can all track back to automation.
Tell us a bit more about this automation process. What's actually going on typically? Give us an example of that.
Oh, I love it. So I'm a chemist by training, but the same narrative will apply to biology. We're essentially just doing reactions. So as a chemist, when I started my career, sadly 30 years ago, if I did 6 reactions a day, I filled 6 pages of a laboratory notebook. I went home and I was tired. Now in chemistry, we can do easily 3,000 reactions a day. Easily. What that does is, if we're faced with a problem or a challenge, we can design an experiment where not only are we using our intellect to design the right experiment, we're also giving ourselves the opportunity for the breadth of the experiment. So we can set that up in the morning. I don't trivialize the setup. Hit go, 24 hours later, we can have done a couple of thousand experiments. The watch out is now one scientist can easily generate up to 1 terabyte of data in a day, which is why the skill sets we need for a chemist, such as myself, there would be an expectation for me to be able to handle up to 1 terabyte of data. How would I interrogate that? How do I know if I've actually got the the gold
Yeah.
out of all of those reactions that we automated.
And what about beyond science? So, you've got a particular interest in raising the profile of science and all science-related careers and work amongst young people in the area.
Yeah, and this you can see now I'm smiling as soon as I talk about our commitment. So we call it STEAM, science, technology, engineering, arts and maths. Before I talk about what we do, I'm just so thrilled arts is now in there.
Yeah.
That's just absolutely
didn't
brilliant.
Used to be,
no, it didn't.
No.
So that's rock on.
Mm.
So Vertex has a long-standing commitment to STEAM and scientific education. Very planful, very intentional, and not just in Oxford, also in our Boston site, also in our San Diego site. So it's a global effort. And we really focus on students and schools where maybe these young people don't have the opportunity to touch contemporary science. So we really focus on those schools and students. I'll start with just some numbers. In Oxford last year, we engaged with over 1,000 students. Globally, 4,000 students. But the numbers only tell, 1/10 of the story. The bit I love is we have a 3-week internship. We typically take on per annum 15 year 12s. And when I talked about a buzz on site, oh my word, there's delta buzz.
So hang on, how old are year 12?
Typically 16, 17s.
Right, so just sort of A-level age.
Yeah. And they are just at the age to get hold of them.
Yeah.
So when I referred back to Mr. Peck, I'd love to be here in 10, 15, 20 years' time. Well, actually, I'm not sure I would. I'd love the next site head to be here in 15, 20 years' time. And for them to say, the first touch I had of science or Vertex was the internship. I just think that would be incredible. Mm. So we have them on site for 3 weeks. They get to do literature research. They also get to do wet research in state-of-the-art laboratories. And you can just see them growing. It's tangible. Mm. So at the end of their 3 weeks, they do a poster to talk about literature and wet work. Last year, our Member of Parliament turned up. And to see these young people representing themselves, their science, Vertex, it's just extraordinary. And I did actually have a little tear in my eye. And I was thinking, where's Mr. Peck?
Yeah. Well,
he'd have loved it.
He would have done. Schools are great, but there's nothing like getting into a lab when you're a kid. Seeing it, you've never seen anything like it.
No.
I think you can't overstate how important that exposure is to kids at a young age, I think.
I completely agree. And then just going back and thinking about the automation, they see our robotics, our automation. For them, it's like Star Wars. It's just they're blown away.
Yeah.
And I don't think they associate.
Are they rebels or are they on the Imperial side?
I don't know. As long as I'm not Darth Vader, I don't mind.
What about the future? What more can we expect from Vertex coming down the line?
So the future's bright. And I think if you're going to try and tackle causal human biology, you've got to roll up your sleeves. You are taking on challenges that other people may look at and think are impossible. They're not impossible. You've just got to be tireless, relentless, and just keep going. And have a community where you can lean on one another, because it's hard. Mm-hmm. I always remind myself and other people the Vertex logo is actually a triangle. And the reason it's a triangle is because it's chemistry, biology, physics playing together to do the impossible.
Oh, that's a great place to end it on. That's about all we have time for. David, thanks for that chat. It's fascinating insight into your whole world. Thanks to you for listening. That's all for now. Thanks very much.